My armamentarium is my PPE, gown, mask, eyewear, and gloves, and then my probe, specifically the Marquis probe, and then the neighbor's probe if needed, the dental mirror, and then also floss. The probe is a double-ended unpaired instrument. It has color coding used to measure and record depths up to 12 millimeters. The main function of the probe is to assess the health of periodontium, but it can also be used to measure the cowl, recession, width of attachment, size of intra and extraoral lesions, bleeding areas, determine the mucogingival relationships, and monitor the longitudinal response of the periodontium to treatment. The first steps before even inserting the probe include asking the patient questions about any past conditions, for example, gingivitis or periodontitis. We should also be using proper patient and operator positions. The probe can also be used to determine recession. To determine recession, we locate the CEJ and insert the probe into the pocket. We identify the free gingival margin and then measure the distance from the CEJ to the gingival margin. We then record the recession in millimeters. To check for frenal attachment, we gently pull the lip or the cheek outward and observe the frenum and surrounding gingiva. We check for movement or blanching of the gingival margin and then record whether the frenum attachment is normal or high. The first tooth probed was number 8 on the lingual side, slowly inserted and walked in 1 millimeter steps across and then slightly tilted to get underneath the coal area. The next tooth was number 14 on the buccal side. Slowly inserted and then walked across. I did slightly skip due to not walking in 1 millimeter steps, which should be improved. Next, for number 24 facial, same thing, slowly inserted and slowly walked across. Something that can be improved is my fulcrum. For number 30, same thing, slowly inserted and walked across, and then a slight tilt to get underneath the coal area. Some other elements that should be recorded are the width of attachment, bleeding and separation, mobility, furcations, and open contacts. And finally, maintain asepsis.